Traumatic and spinal cord injuries. A traumatic injury can be a brain injury or a spinal cord injury. A traumatic brain injury usually happens from the head being hit or jolted very suddenly. It can also happen because an object goes through the brain, like a bullet or a shattered skull fragment. These injuries can be caused by falls from a bed or a ladder, down the stairs, or in the bath. From vehicle collisions, violence, sports injuries, or explosions and combat injuries. There are many different symptoms when the client is first injured, but other symptoms are chronic, such as paralysis, problems swallowing, intellectual problems like problems with reasoning, organization, planning, and decision-making, communication problems like problems speaking or with social cues, behavior changes, a difficulty with self-control or wanting to do very risky behavior. Emotional changes. Often people have depression, anxiety, mood swings, or a lack of empathy. And they may have sensory problems. They may lose their vision, hearing, or have ringing in their ears. A traumatic spinal cord injury is any damage caused to the spinal cord that causes permanent changes in strength, sensation, or any bodily functions below the site of the injury. There are two types of injury. There's complete, where all feeling and movement is lost below the site of the injury, or incomplete, where there's some movement and sensation left below the site of injury. The amount of paralysis or inability to move or feel depends on where the injury occurred. If the injury is lower on the spine, the arms and the hands and the trunk will not be affected. There are two types of paralysis: quadriplegia, which affects the arms, hands, trunk, legs, and pelvic organs, and paraplegia, which only affects all or part of the trunk, the legs, the pelvic organs, but not the arms and hands. The paralysis is always from the bottom up. You will never see somebody with a spinal cord injury that can use their legs, but not their arms and hands. There are many complications from a spinal cord injury. You could have loss of bowel or bladder control, pressure injuries, circulatory problems, difficulty taking breaths or difficulty coughing, a decrease in bone density, difficulties with muscle tone. Sometimes the muscles are too tight, or sometimes they don't have enough tone and their limbs are floppy. They can have pain in the muscles or in the joints. And of course, they can have depression. How can the home health aide help with spinal cord injuries? One way is to prevent pressure injuries. This is very important and a very common complication with people with spinal cord injuries. Because they often have no sensation on their legs or their back, make sure that there's no pressure on any part of the affected body. Use pillows or cushions to protect ankles and feet. Assist clients with passive range of motion exercises, which means exercises where you are moving their limbs back and forth. This is often prescribed by a physical therapist. Assist the client with their activities of daily living, and assist them with eating and drinking if necessary.